And welcome to part 2 of why they don't want the vaccine, the practical side. So, why are there people who do not want to take this vaccine? In this part we will hear about some of the practical issues, and as said in the introduction, I'll read from the forms provided by GAP. I'll only read some of the highlights, but you can read the forms yourself. You will find the relevant links in the description of this video. So, let's start with the practical side. Number 1. The low mortality rate of the disease. The practically low mortality rate of the disease, but also its distribution by age, clearly denote that vaccination, whenever it becomes feasible, must be targeted. Recent studies, which have estimated the number of deaths in relation to the actual number of people exposed to the virus, based on serological tests, antibody tests, in a specific geographical area, have determined that this percentage is of the order of magnitude of seasonal flu, certainly lower than 1%. The fact of the matter is that COVID has a 99.74% survivability rate, so saith the CDC. Number 2. COVID mainly affects people in the 3rd and 4th age groups. COVID mainly affects people in the 3rd and 4th age groups, where the phenomenon of immune deficiency occurs. That is, the reduction in size, quality and duration of their immune response protection, which can occur after being vaccinated. In other words, the vaccine-induced active immunity may not be capable of protecting the elderly, who are the par excellence target of coronavirus. Hence, the finding of an antiviral therapy should be priority, assuming that the protection of the elderly is in fact what is desired. The youth are affected very marginally, almost not at all. Number 3. Asymptomatic transmissions of COVID are too insignificant to warrant the mandate of a vaccine. Researchers at Nature Communications and the Journal of the American Medical Association both found that asymptomatic transmissions of the coronavirus are less than 1%. The vaccine's main purpose is to prevent the spread of the disease to others, but that is already incredibly unlikely, not only due to natural herd immunity, but also because at this point in time most people who have desired the vaccine have received it, making any mandate of it among those who do not want it frivolous. Point number 4. Among the seriously ill, the vaccine may actually cause more harm than good. With seriously ill patients, acute respiratory failure occurs through an immunopathological mechanism, a storm producing inflammatory cytokines, and reducing CD4 and CD8 T mediated immune response. Well, I don't really know what it means, but I know that it actually invokes a very hefty response in the body. Immune response, that is. There are serious concerns that vaccination will exacerbate the immune complication in the event of a subsequent viral infection and will consequently worsen the patient's clinical course. So again, it's like that the immune system is overreacting as a result of the vaccine. Number 5. In the 12 to 29 age group, there has been a notable risk of heart inflammation due to the COVID vaccine. The vaccine has caused multitudes of people who are not allergic to any product in them to suffer heart inflammation. Many have even died. Therefore, the COVID vaccine is not only a spiritual threat. Number 6. The vaccine is temporary and will go obsolete. Will you mandate future developed vaccines to future mutations of COVID? The logic of eradicating an infectious disease through global vaccination, on the one hand, presupposes the existence of a very safe and very effective vaccine, and on the other hand, most importantly, that there be no other host of the virus in the natural environment. That is, man has to be the only species that can host the virus. This is true of the polio virus, but it does not apply to the coronavirus, because all research suggests that the virus originated from bats. Coronaviruses, being RNA viruses, mutate rapidly, gaining genetic and therefore antigenic diversity. 2 types have already been identified for SARS-CoV-2, S and L. It is doubtful that a vaccine can provide both equal coverage for all strains of the virus that emerge, as well as permanent protection over time, hence underlying one more time the importance and priority of finding antiviral drugs against coronavirus. Why all the rush for a vaccine that does not promise much, but is the cause for concern in the scientific community, especially if it is produced in a hurry and implemented en masse? Finally, do the pharmaceutical industry serve man, or does the opposite apply? Number 7. Multiple eminent health authorities from all across the world have warned against the safety and efficacy of coronavirus vaccines. Dr. Peter Hotez, UK scientist Hilda Bastian, and former Vice President of vaccine manufacturer Pfizer, Dr. Michael Yeadon, have all warned against the safety of the COVID vaccine due to the nature of their creation. Vaccine development usually takes many years or decades, whereas the coronavirus vaccine has been manufactured in less than 12 months. I am not comfortable with receiving a fast-tracked product, as by definition, fast-tracking a product means there is no data on long-term safety. Point number 8. Pfizer CEO unable to say if vaccine will mitigate COVID transmissions. Albert Bourla, if that's the way I pronounce it, CEO of Pfizer, was unable to confirm if any of effectiveness of the COVID vaccine. The vaccine certainly has greater risks than it does benefits. Number 9, the last one. Adverse reactions and death caused by the vaccines are underreported. According to a study done by Harvard at the commission of the United States government, less than 1% of all adverse reactions to vaccines are actually submitted to the National Vaccine Adverse Event Report system. These problems have yet to be fixed. So, there you have it, the most common practical objections against the COVID-19 vaccine. Some of the objections might not be a problem for you, and that's okay. I did not read them because I want you to agree on them. No, the thing is that many just don't understand why people would want to refuse the vaccine. Hopefully, by hearing this list, they'll see the issues. People who do not want to take this jab are generally not crazy or stupid. Most of them are honestly worried, and can you blame them after hearing this list? Okay, I'll cut the video again here. In the next one we will read the religious objections, expostulations. That's a fancy word for objections. I found that in my synonym book. Anyway, in the meantime, you can start following me on Odyssey by accepting my invitation, and doing so gives us both some free LBC. Alright, go. Watch the next one.